시청자 여러분 안녕하십니까? 현대의학과 건강 100세를 담당하고 있는 신경내과 전문의 전희택입니다. 오늘은 UCLA 대학병원에서 새로이 발명된 경도관 대동맥 판막 대체술을 직접 시술하고 계시는 서명원 박사님을 모셨습니다. 서 박사님은 시카고 대학을 거쳐 프리스커 의과대학을 2002년에 졸업하시고 UCLA 대학병원 내과 레지던트에 이어 하버드 의대 부속병원인 매사추세츠 제너럴 하스피탈에서 심장내과 전문의 수련을 마치시고 2011년에 다시 UCLA에 오셔서 현재 심장내과에서 도관을 사용하는 대동맥 판만 대체술 전문가로 활약하고 계십니다. 그러면 서 박사님을 소개하겠습니다. Dr. So, thank you for coming over.
Thank you for the opportunity to be here.
So let's get to the point. We'll be talking about aortic valve replacement procedure.
Yes.
Particularly transcatheter aortic valve replacement.
Yes.
Unlike open heart surgery, you don't have to have general anesthesia, stay in the hospital 5-6 days, and you're using special device you brought today.
Yes.
So tell me, how long is this particular device been around?
So in the United States, this procedure has been FDA approved since 2011.
Okay.
Prior to that, it was in clinical trials.
Mm-hmm.
So it's been around as an FDA approved procedure for the last 3 years.
So it's a very new device.
Yes, it's a very new device, new procedure.
And this particular device is unlike open heart surgery. You don't have to open your body, and you do it under conscious sedation, I guess. Is that right?
In some places, the procedure is being done under conscious sedation,
Mm-hmm.
but most cases we still do general anesthesia. But the main difference with this procedure, the transcatheter procedure, is that we don't have to do open heart surgery, having to open the chest.
Right.
So we can actually do the procedure by going through the groin artery instead.
Right. You don't have to cut open your chest.
Yeah, we don't have to cut open the chest and open the chest altogether.
Okay. So now you brought some demo units. What is the aortic stenosis? What happens to the valve? Can you show me with the sample unit here?
Yes. So aortic stenosis is, a process in which the valve becomes narrowed because of calcification.
Correct.
So a normal aortic valve is
That's a normal. Okay.
Yes, this would be a normal aortic valve. Has 3 leaflets, 1, 2, and 3. And these valve leaflets should be nice and pliable so that when the heart pumps, the valve opens. When the pump relaxes, then the valve closes, doesn't allow for a leak back into the valve.
Then blood flows through.
Flows through in one direction.
Okay.
So in calcific aortic stenosis, and this is more common in elderly patients, calcium gets deposited into the valve leaflets. And that calcium is rock hard and causes the valve leaflets to become immobile. And so now
Immobile, it doesn't move.
It doesn't move. And so now when the heart is pumping and trying to push out the blood, the valve doesn't open.
So
and then sometimes can cause the valve to leak.
Cannot go through.
No, it can't go through. So when the main pumping chamber is not able to push through the blood, pressure builds up in the heart. And that pressure can cause people to feel chest pain or chest pressure, shortness of breath, especially when doing any activities. And then some patients can also feel lightheaded, dizzy,
Pass out.
and maybe even pass out and faint.
Okay. So what causes aortic stenosis? What is the most common causes of the stenosis?
So it's the process of calcification, and we believe that the process of calcification occurs due to plaque buildup, similar to atherosclerosis, so hardening of the arteries due to cholesterol.
Okay. Sometimes doesn't it caused by rheumatic fever, scarlet fever, kind of febrile illness during earlier stage?
So in underdeveloped countries, rheumatic heart disease is still a problem. But in the United States, with with antibiotics and proper treatment, rheumatic heart disease is uncommon. We do still see it, especially in immigrant populations, but for the most part, in the United States, age-related calcific aortic stenosis is the most common cause.
Okay, so before this device was developed, what was the old way of treatment for this advanced aortic stenosis?
So the typical treatment for aortic stenosis had been open heart surgery, in which the surgeon would open the chest, expose the aorta, and the surgeon would cut the aorta open, and then cut out the leaflets, and then sew in a brand new valve. But open heart surgery is a major operation. The recovery time of the surgery can be long, at least a few days in the intensive care unit, probably at least a week in the hospital. And patients, take a longer time to recover since it takes a few months for complete healing.
The risk of the surgery is very high too, wasn't it? I mean, isn't the heart has to be under circulatory arrest during this open heart surgery?
Yeah, so when before the surgeon can cut the aorta open, the patient has to be put on the heart-lung machine. Correct. To take over circulation while the surgeon does the repair.
So how long the procedure used to take?
So in the operating room, it takes about 4 hours.
4 hours, okay. It's a long surgery.
It can be, sometimes longer.
And the recovery in the hospital is also prolonged.
It can be, yeah, especially in older patients and those patients that have other comorbidities, such as heart failure or diabetes.
Congestive heart failure.
Yes,
renal failure.
Right, kidney disease, liver disease. These are other comorbidities which increases the risk of that patient having open heart surgery. So age also is a risk factor. So a lot of these patients that we see with aortic stenosis are in their 80s, maybe even their 90s. And so doing open heart surgery in these patients also can be very risky.
They cannot tolerate the open heart surgery under this kind of condition.
Many of them cannot tolerate it.
Yeah. So now we can do it without the surgery within an hour with using the catheter. So tell us about the catheter method.
So this catheter-based procedure has really opened up the door for many patients who could not get treatment for their aortic stenosis to now being able to be treated. So let's start off with the valve first. So this is a valve, and this is actually a model of the Sapien XT device, which is the brand new device that was just FDA approved just a few weeks ago.
Okay.
So this valve is comprised of a metal stent, and the metal stent is made out of cobalt chromium, a metal alloy. And on this metal stent, there are 3 leaflets sewn on to the stent to make a valve. And these leaflets are made out of the heart lining of a cow, so bovine pericardial leaflets.
Okay.
So this stent then gets crimped onto a balloon. The balloon is here, and the stent gets crimped onto the balloon, and we have a special device to help crimp this down. And basically, the crimper will squeeze the stent down onto the balloon to make it a much lower profile.
Okay. So how small that becomes? What are the diameters?
So the 23 millimeter valve is a 16 French device, so it's about 5 to 6 millimeters.
5 to 6 millimeters. Okay, very small.
Much smaller than previous generations.
So that's the difference between the prior model and the new recently approved model XT?
So the older device, the first generation device, was a much bulkier device, which was larger in diameter. So this allows the procedure to be done much easier, with less complication. So this is an example of a delivery sheath, and this is the tube that gets inserted into the artery in the leg.
First you insert that.
Yeah, so this will gain us access into the arterial system. And so this gets then pushed into the body, and it's then through this delivery sheath that we can put in the valve. So now you have a hollow tube that's sitting in the artery.
Artery.
So then we can then put the whole delivery system through that sheath and then navigate it over a wire to the aortic position. And the aorta is curved. So they actually developed a flexing mechanism on the catheter to then allow for us to be able to then navigate that curve.
That curvature.
Yes.
Okay.
So once this balloon with the stent gets put into the aortic position, we then inflate the balloon then to expand the stent into position. Okay. The aortic valves stenosis, the aortic calcification that's already present gets actually pushed to the side by the stent, and it's the calcification within the valve that ends up serving as the anchor so that the stent doesn't fly away after deployment.
So you don't remove any scar tissues, anything like that? You don't sew it up, anything?
Yeah, nothing.
No use of a surgical knife at all then?
No use of a surgical knife. Everything is done through needles and the catheters.
Okay. And you follow with continuous X-ray monitoring, fluoroscopy?
Yeah, so the procedure is guided by fluoroscopy, which is a special type of X-ray. So we're able to see where the catheters are in the body by using the X-ray equipment.
So how long the procedure lasts, average duration?
Yeah, the actual implantation procedure is about 1 hour.
1 hour. Yeah. Okay. And how the patient tolerates this procedure? Much better than open heart surgery, no question.
So we had a patient last week that got the procedure, and he ended up being discharged from the hospital just 2 days.
2 days. That's great.
Yeah.
And patient, how old was she?
He was around 68.
And what the preoperative condition, ambulatory condition?
So he had a history of prior heart surgery with bypass, and the surgeon ended up using his right internal mammary artery as a bypass graft.
Okay.
And that right internal mammary artery went across the chest to the left side of the heart. And because of that graft being in the way, it would make a repeat open heart surgery too risky. So for that reason, he was considered for the transcatheter approach. He also had a history of atrial fibrillation.
Okay.
But those were only
his... Thinners?
Yeah, but those were his only two real significant conditions prior to the procedure. And he did very well.
So he, before the surgery, he was able to walking.
He was walking
without assist.
He was walking, but he over the last few months has noted a continuous decline in how much he was able to do before he started feeling short of breath.
Short of breath. Okay.
So it was very life limiting in that sense.
After your procedure, patient is much more comfortable, I guess. How did they do?
No, so immediately after the procedure, the next day, we had him walking around the ICU, and he felt that his breathing was already improved just 1 day after the procedure.
That was great.
Yeah, it was a great result.
So you mentioned that the patient is now most of the advanced aortic stenosis patient is very symptomatic, and they will require some kind of surgical procedures or interventional cardiology procedure. So what are the alternative medical treatments in these patients?
For those patients with aortic stenosis?
Right.
Because aortic stenosis is a mechanical problem, there's an actual valve that isn't able to allow blood flow out of the heart. There really isn't any good medical therapy to treat it. Now, there have been attempts in the past of trying to use cholesterol medicines to help stop progression of aortic stenosis, but that actually hasn't panned out.
I see.
The main medical treatment for these patients is if the aortic stenosis causes congestive heart failure, so the pump becoming overloaded or weakened, using medications like Lasix as a diuretic, a water pill, to help remove extra water that may be building up in the lungs. But besides this procedure, the transcatheter procedure, or open heart surgery with valve replacement, there really isn't any other good treatment modalities. So it's either going to be surgery or transcatheter valve.
No significant alternatives.
No.
So okay. Then what is the side effects, if I could say that, of this transcatheter procedures?
Yeah. So the aortic annulus is not a circular structure. So that's the actual annulus that forms the aortic valve. It's not circular. It's actually more oval. And we're putting in a circular stent into a non-circular structure. So because of that, there is a chance that you can have leak around the stent.
I see.
So that is one of the limitations of the current device, is if there is mild, moderate, or even severe leak, then that could cause a decreased life expectancy after the procedure.
You can have a stroke.
So both procedures, both surgery and the transcatheter procedure, there is a small risk of stroke. In the clinical trials that have been done, that risk is equivalent. So it's the same for both surgery and for transcatheter valve. And then because we're going through, we're making a pretty good size hole in the artery in the leg, there is a chance for a vascular complication. So there can be damage to the artery that we use for the delivery. So those are the main issues, is vascular complication, leak around the valve, stroke.
And since this is an artificial device, how long does this device can stay in place?
Yeah.
5 years, 10 years?
That's a very good question. And right now, we don't know.
Too early.
It's too early.
Right.
So from the surgical valve replacement standpoint, we estimate that a surgical valve would last about 15 years.
15 years.
15 years. And now the valve leaflets that make the surgical valve and this valve are made both of bovine pericardium, treated the same way. So the procedure has been done much longer in Europe, and they now have almost 10 years of experience in Europe. And all indications are that the transcatheter stent valves are probably going to be as durable and last as long as a surgical valve.
As durable as open heart surgical valve.
It seems like it's going to be that way. But right now we don't have long enough data to know if it's going to really last as long as a surgical valve. So hopefully the next 5-10 years we'll be able to answer that question.
So now what about any procedure will have mortality involved? Now, how is your mortality compare to open heart surgery?
So the mortality is very similar to open heart surgery.
2 to 3%?
Yes, exactly. Now, in the more recent clinical trial using a different device than the core valve device, they had a clinical trial which actually showed that the mortality from the transcatheter procedure was better than surgery. So there is more data continuously being produced and in support of the transcatheter technique as the treatment of choice for aortic stenosis.
So your prognosis of these patients who undergo transcatheter aortic valve replacement surgery, how do you perceive the prognosis?
Yeah, so
as good as surgical patient, better? If so, how much better?
Yeah, so from the clinical trials, we can estimate that it's going to be just as good as surgery. But you have to remember that these were patients that were high risk and oftentimes elderly. So they oftentimes pass away from other things than their heart disease. What we've seen is if they have a very good result with the transcatheter valve procedure, they end up having a better quality of life because they're able to breathe better, they're able to do more. So we anticipate that they would have a normal life expectancy and a good prognosis.
So they feel better compared to the surgical patient.
Well,
Symptomatically, they feel better.
They do feel better faster.
Recover faster.
Recover faster. The surgical patients do feel better. It takes them a little bit longer to feel better. And then the clinical trial data suggests that the improvement in symptoms is similar between both treatment modalities.
Okay. So how long UCLA has been doing this transcatheter method of replacing aortic stenosis?
Yeah, so we've been doing the procedure now for 2 years.
About 2 years.
Yeah, August of 2012 is when we started.
Okay. Dr. Seo, thank you very much. I know you're a busy person.
Well, thank you.
It's been very helpful.
Yeah, thank you so much.
오늘의 의학 정보가 시청자 여러분들께 많은 도움 되셨으리라 믿습니다. 자세한 내용은 주치의와 상담하시기 바라며 저는 다음 시간에 다시 찾아뵙겠습니다. 안녕히 계십시오. 감사합니다. Thank you.